Good evening, everyone. We'll be starting the session soon as people are still joining in.
Hi, Pavitra. Good evening.
Sir, good evening, sir. Thank you so much, sir.
Yeah. I was waiting for this.
Good evening.
I was waiting for this.
Good evening, sir.
Hi, Satya. Good evening.
Good evening, sir.
Good evening.
How are you, sir?
I'm very fine. Thank you.
Thank you, sir.
Yeah. Hi.
A very good evening, everyone. I would request our HOD, Professor Dr. Satyaranjan Mishra, sir, to start the session.
Very good evening to one and all present here. It's the first webinar we are doing in the evening. Usually we conduct it from the college, so it is from our respective houses. So there might be internet issues because we are separate. So I apologize from the beginning for that. And this talk was actually oriented for our interns because they are the ones who are the most affected by this COVID-19 pandemic. And my friends, Dr. Pavitra and Dr. Satya Kumar, they have been kind enough to share their experience, how the pandemic has affected dentistry, the way we practice dentistry, as well as how we have to modify our dental setup. So those of you who are going to start your practice soon, it will be a real good thing for you to be guided by them. So I will also add a few things that when I joined my PG, and that so my have a memorable evening today, and we all get to learn something. And I wish my teacher, Professor Ilangovan sir, is also there to be here and learn from everyone. Thank you, Dr. Rupsa. Kindly formally introduce sir.
Pavitra Bhaskaran is the Chief Dental Surgeon of the Tooth World Clinic since March 2004 and has got a clinical experience of about 16 years. She also has an academic experience of 8 years when she worked in reputed institutions like SRM. She finished her college. She finished her graduation in the year 2003 from the Tamil Nadu Dr. MGR Medical University and post-graduation in oral medicine and radiology from Savita Dental College in the year 2008. She has 16 publications to her name, both in national and international journals. Her article on the oral presentation in dengue hemorrhagic fever, a rare entity, was cited by Crispin Scully in Oral Diseases 2015. She has presented several scientific papers in various national conferences and was also a part of organizing team in national conferences. At the clinical front, she has keen interests in restorative dentistry and management of several oral potentially malignant disorders and mucosal lesions. She believes in ethical dental practice, ensuring complete quality dental care to all her patients, and strongly supports her team at the Tooth World. Now coming to Dr. M. Satyakumar, is associated with SRM Dental College since 2009 and is also the Chief Dental Surgeon at the Tooth World Dental Clinic, Chennai. MG Dental University in 2009 Dental College. He has also an additional fellowship that upgraded skills in aerodynamics. He has 24 publications in national and international journals, most of which are indexed in Scopus and PubMed. He has contributed as an author of the chapter to the book Textbook of Oral Pathology, Elsevier Publications in 2013. He has a great passion for teaching and has played pivotal role in his college, NIRF, and CQC. Research has always been his area of focus and is also in the editorial board member in International Journal of Head and Neck Pathology. He has a rich clinical practice of 16 years and has been providing quality care to his patients. He believes in ethical practice and always likes to spread knowledge of dental awareness. I welcome you both, sir and ma'am, and it is indeed our pleasure to hear from you. Over to you, ma'am and sir.
A very good evening to all. Thank you, Dr. Satyaranjan Mishra and Dr. Rupsa for the warm welcome. And thank you, Mishra, for inviting us and giving us a wonderful platform to share our experiences. I think I have a few more thanks to start. I would first like to thank my dear postgraduate teachers, Dr. N. Yamsundaram sir, Dr. Maragathilli ma'am, Dr. Ilangovan sir, who is here with us, Dr. Uma Maheshwari ma'am. Ma'am, thank you once again, Uma ma'am, for the wonderful video, and Dr. Arvind sir. And at this outset, I'd also like to thank my dear undergraduate teachers, especially Dr. Munratnam Naidu sir and Dr. Jayakumar sir, And a last bit of thanks to someone who has molded me as a dentist and who has always been a strong pillar of support. It goes to late Dr. N. Hemachandran, who's really motivated me to take up dentistry and continue my practice. It's a pleasure to be here. And I hope my slides are visible and am I clearly audible?
Yes, yes.
Can I just start?
Yes.
Okay. So firstly, pranams to Lord Jagannath, and thanks Dr. Roopsa for this wonderful painting which has spread in air and across all your webinars. It's really nice to see such an intense and deep painting. Great thanks to you. Okay. Dental clinic startup in COVID era, a beginner's guide. Many fresh graduates will surely be thinking in their minds, is it possible to start a clinic now when the pandemic is spreading its chills all over? Initially, when the lockdown was announced, we all immediately just shut our clinics and sat back, not knowing what to do. Clueless we were, even if we could open back. The only option available at that time to manage our patients was teleconsultation, which I'm sure most of the dentists do not prefer it. Or it is only we who know that a case of pulpitis cannot be managed with teleconsultation. Slowly, with the help of our seniors and pioneers in the field, we began to gain knowledge of how we could practice dentistry safely without any risk to ourselves, our staffs, our families, and our dear patients. Today, most of our practicing dentists are well equipped and we are confident we would not let another pandemic close our clinic doors. There are many juniors and their parents who still have the doubt that whether practicing dentistry is safe or unsafe. I would definitely say that it is very safe. This presentation is for all those young minds with a dilemma as to what would be the next step. Plenty of options are available for you. You could have higher studies, you could fly abroad, you could pursue with research, pharmacovigilance, etc. But if your inner mind has always been ringing, I want to be my own boss, yes, dental clinic is the right choice for you. Okay, now having chosen that, okay, I can start my clinic, well, I think that's a good choice. You will have to face another set of banging questions. So these questions you might be asking yourself, or people around you would definitely pose it to you. Why, where, can I, how, and so on. Okay, with this presentation, I hope to answer these questions to some extent. Okay, the outline of our presentation would include the goals, prior requirements and certifications that are needed for a dental practice, basic principles involved in setting up the dental practice, and setting up of the different zones in the dental clinic, emergency drugs that you need to always have in your dental clinic, and a take-home message. Over now to the goals, which I feel is strongly, I think each and every one of us should strongly follow these two goals in our mind. One is to practice dentistry ethically. And yes, what COVID has taught us is that we also need to practice dentistry safely. We need to give our patients utmost care, and we should be well prepared for any kind of emergencies. Over now, let us see what are the prior requirements that would be needed. Firstly, once your internship is completed, you get yourself registered with the State Dental Council. Next, when you have decided to open up a dental clinic, you get familiar with all the DCI norms that are required for a dental practice, I think, and it is very much available in the DCI website. Secondly, improve your skills. A wide knowledge in medicine and dentistry, empowered with precise skills, is one of the major keys to be a successful practitioner. Improvise yourself in areas wherever you feel you're lacking. And next, what I would suggest very important is BLS, which is the basic life support. In case of any emergency in the clinic, we need not panic, and definitely we could handle such situations. Over now to the next important requirement, which is location. It is very difficult to choose a location. The next important step is identify the right location and meet the requirements for it. Be very wise when you choose your location, as this dictates your entire setup. You may decide upon occupying your own space, or you can even think of taking up a space for rental. But when you're selecting the location, be extremely careful. You may just see a place where there are no dentists, and it may be tempting for you that why not, there are no dentists, so there could be no competition. Why not we start a practice here? But always think twice. Of so many years, why no dentist has established any practice in that particular region? There could definitely be a reason for this, and this is what one of my professors had taught me first. If you're thinking of your own place, it could be an existing one, which you may just remodel, or you may even like to buy a new place. A rental place, you need to remember, it always adds up to your monthly expenditure. And there is a probability for rents to keep increasing, which makes it difficult for us to plan our budgets. Minimum requirement. In our state in Tamil Nadu, we have the Clinical Establishment Act, as per which we require a minimum space of 300 square feet for a single chair and should definitely have a restroom facility. Next, over to commercial and residential zones. It's up to individuals' choices. Commercial zone would definitely have an increased visibility, while in a residential location, you're assured of a peaceful practice. Depending upon the size of your clinic, try to provide them parking facilities, especially now with increased number of vehicles and patient time constraints. We find this to be very, very important. And while selecting the clinic, ensure there is adequate ventilation. This is one thing that COVID has strongly taught us, and there should be access even for disabled patients. Moving over next, the most important aspect, which is very, very, very important, is your finances. So you need to plan your finances wisely. So it's your individual decision whether you're going to make use of your own funds or you can avail your bank loans. Before you apply a bank loan or before you think of even investing your money, get all the required invoices and draft a complete budget of all the money that would go into establishing a clinic. Next, it is important at this stage to calculate also the monthly expenditure, which would include rent if it's a rented place, and your loan repayment if you have availed a loan, and your monthly electricity, water, and property bills. Further, material purchase and the salaries that you would have to give for your staffs. This I have given the basic expenditure as per our experience, and this could vary from individual to individual and what type of clinical setup you establish. Over now next to the certifications and the agreements that we will be requiring for our practice. As I already mentioned, the DCI registration, which you will be taking immediately after your internship, and you need to get your state DCI number for you. Next is biomedical waste segregation and disposal. So I will be talking a little bit more about biomedical waste segregation and disposal later, but basically you enter into an agreement with a government approved contractor in the locality who would pick up the biomedical waste at prescribed intervals of time. Following this, you get an approval from the State Pollution Control Board. And as per our state in Tamil Nadu, we are all registered with the Clinical Establishment Act, which sets an ideal standard for clinics, hospitals, and any other healthcare. Next, most important for us is AERB, which is the Atomic Energy Regulatory Board. It is a certificate that is issued for all radiographic machines, and most of us would definitely at least have an intraoral radiographic machine. Now let's see what could be the key requirements when you're planning to start the dental clinic, how you can plan your dental clinic, and what are the requirements for it. First, ensure accessibility. As I already said, your clinic should be accessible by both staff, patients, and especially disabled persons should also be able to use your dental facility. Next is function. How well the office provides an environment for performing tasks and effectively supports the desired oral health outcome. Compliance. This is adherence of the practice of dentistry to the regulations that govern it. Next, aesthetics. Yes, aesthetics is definitely important, for it adds to the visual appeal to our visitors. But always, when you're thinking about aesthetics, you need to also think that there is quite a lot of money that goes into developing it aesthetically. But a little bit of aesthetics that gives a pleasant patient experience is required. Okay, having spoken so much, so I think I should have brought you all to a little bit of thought that, okay, we can think and go and start our clinic. Okay, let's begin. So first make up your mind whether you're going to go for a single chair or multiple chair facility. If you're going for a single chair, the space is important, and multiple chairs, again, you need to decide upon what kind of partitions you will be giving and all that, which will also be discussed later. Next, your displays, your prescriptions should be ready. Definitely should include the aim of the practicing dentist with the qualifications and his or her registration number of the State Dental Council. The address of the facility and the consultating hours should also be clearly mentioned. Next stage would be you collaborate with your labs who would be doing your prosthetic or your other works. And then with radiographic centers, this is especially if you only thought that you will have an intraoral radiographic machine and you need your OPGA and lateral ceph and other radiographs, you can definitely collaborate with your radiographic centers in the neighborhood. Next, equipments and instruments. This also we will be putting up a little later. Next, staff employment. This again is very important because dentistry is one field where, okay, today I think I want to start my clinic. I just go sit, open the clinic, and I myself will sit and start. No, it is not possible. We need additional people to help us and to carry on our practice successfully. So initially what we would advise is that keep your expenses to a minimum. Based on what we have come across all these years, we feel that you need at least one staff each for the reception desk, operatory, and the housekeeping. This is again individuals' choices. It could vary. You might think, okay, I will cut down and I can manage this, or you feel you can have some more staffs. You can definitely have this again. You can decide. I leave it. It is individual choices. Okay. Now, having spoken so much as to how your finances should go and what kind of requirements are needed, what are the certifications needed and all this, let's go into the actual story inside, which as house surgeons, you would have been seeing the operatory, the dental chair, the compressor and all that. Slightly things more than that as you enter inside a dental clinic. So be it a small, medium or a large space that you have chosen, these zones, namely the waiting arena with the reception desk, the triad zone, sterilization, operatory room, laboratory, donning and doffing zones, need to be earmarked clearly so that the patient has a pleasant experience. This is a floor plan that depicts how a dental clinic can be planned incorporating all the required facilities. This is the triad zone. Now, in the COVID era, it is the triad zone which has evolved as the most important zone in the clinic. For the next 2-3 sentences, I would just be sharing you what we follow in our clinic presently. Right now we treat patients only by appointments. So when their appointment is done, the day before they come or on the day of their appointment, a telephone screening is done. We ask them questions regarding history of fever, recent fevers, cough, or any COVID testing has been done. And we request our patients to come without attenders. Of course, exceptions are given for pediatric patients, geriatrics, and disabled patients. And we request our patients that they enter the facility by after removing their footwear, and then we request them to sanitize their hands. The sanitizer is placed on a foot pedal stand. Following this, we check the temperature. If the patient has come with an attender, we also see to it that the temperature and the oxygen saturation levels of the attender is also checked. So once checked, it is duly entered into the consent form and signed by the patient. Then we provide disposables like head cap, gloves, and mask to the patient. We don't allow them to the mask with which they have come inside the dental clinic. So another thing which we ensure is natural ventilation. Wherever possible, we try to use natural ventilation. This again, ventilation is one thing which COVID has strongly imposed in our minds. Over to the next zone, which is the waiting arena. So this was how our waiting arena was looking prior to COVID period. Okay, looking very nice and well-maintained waiting halls. Okay, a few criteria that would be required. This zone is actually the zone which includes seating, walking spaces, entrance doors, and access to the front reception desk. You provide chairs for your patients. It may be expensive or medium rate, but whatever it is required it should be comfortable for your patients, especially because most of our dental treatments are time consuming. So your next appointment patient might have to sit at the waiting hall for longer duration of time. So if your chairs are not good, this could ultimately lead to frustration of the patient. And always use furnitures that can resist wear and deterioration. Install chair rails that can prevent wall damage. And when you choose the fabric for your for your waiting hall chairs, you choose colors which are relaxing and inviting. So again, this all adds up to pleasant patient experience. And when you're thinking about the floor, what kind of floor? Should I go for tiles or any modern, whatever it is? But ensure that you have a matte finish so that there is sufficient grip and it can be used comfortably by patients of all age groups. Additionally, you can have a television, magazine, newspaper stand, educational posters, and a good aesthetic theme. All these could make up a lovely waiting zone. And ensure that you provide a comfortable access to restrooms from the waiting room. Just a second. Over now to the waiting arena. So this is the waiting arena arrangement in COVID era. So this is how our waiting zones look now in COVID era. You can see that the seats have been sealed, so indicating that those seats cannot be used, bearing in mind the physical distance that has to be followed. And then a lot of educational posters have been put up regarding your sanitization, use of masks, and physical distancing. So at a time, we don't encourage more than 2 patients sitting at the waiting zone right now. And again, the waiting hall will be having sufficient ventilation. Over next to the reception desk or the registration desk. So this zone is again very, very important because most of our patients ask a lot of doubts and queries and get themselves clarified with the reception desk. And educate all your staffs, especially at the reception desk, about patient handling. So because this is the zone where you will have your patient arrival and checkout, patient consent forms, case records. Yes, if you're going to have manual case records, you need to provide space for maintenance of the manual case records. Following this, it is this desk which will also handle appointment scheduling. And they also guide your patients before and after treatments. As I already said, it is at this desk where patients have a lot of questions to ask. Then followed by this, you can exhibit your billing and about your digital payments here. And again, at this desk, they also handle your inventories. So this is the front desk that we have at our facility, where you can see our digital payments and then your cards, credit card payments, a computer with a printer, everything could be present at the reception desk. Next, to one of the most critical area in the dental facility, which is the sterilization zone. See, what is important is that contaminated instruments should immediately reach this zone. So I'm not telling that there could be clinics where they could have a separate room for sterilization, or if it's a smaller clinic, you see to it that you dedicate this zone separately, because contaminated instruments can infect staffs as well as patients. So first one is the intake area, where you provide a surface so that the trays can be unloaded and the disposal items such as your disposable cottons, everything can be disposed of, and sharps can be carried to the puncture-proof sharp containers. Next is cleaning. Cleaning can be done efficiently. Nowadays, we use the ultrasonic cleaner, and if required, hand cleaning with gloved hands. Your instruments are then dried and packed into sealed sterilizable pouches. And most of these sterilizable pouches nowadays come with an indicator tapes indicating whether the sterilization process has been complete or not. And in case sterilization pouches are not possible, you can wrap it in clean cloths, and then you can put it into your sterilizer. Following this is the actual process of sterilization, which is done nowadays using autoclave, preferably autoclaves. And autoclaves come in a variety. You have a lot of B-class autoclaves, N-class autoclaves, and pressure cooker type autoclaves. It's up to you to choose, as long instruments are stored properly without getting exposed to contamination. So this is the sterilization requirements. So this is an ultrasonic cleaner, and you have the B-class and the N-class autoclave. Nowadays, we also started using UV cabinets and cold sterilization, especially for heat-sensitive or heat-resistant kind of instruments. You can prefer to use cold sterilization. So this is an entire checklist for the sterilization zone. You can sterilization forceps, trays, surface disinfectants, disposable barriers, sharp containers, and many more. So this is a small sterilization zone that we have put up separately in our facility. You can see the autoclave, the UV cabinet, an ultrasonic cleaner, and always ensure that you have a deep sink and a wide sink so that instruments can be efficiently cleaned. Next, moving on to something which is very, very important, very, very critical these days, is your biomedical waste segregation and disposal. So this is the definition, which states that any waste that is generated during the diagnosis, treatment, or immunization of human beings or animals, or in the research activities pertaining to, or in the production or testing of biological substance is biomedical waste. Next, we should see how this biomedical waste segregation, why it is important. So first and foremost, we know that only when it is segregated well, we reduce the risk of infection. And it is important that the segregation is done at the source of generation. So if you're having a dental check and right next to it, you have your dustbins, ensure that it is color-coded and you drop off your gloves and masks correctly in those color-coded bins. And it should be segregated as per the categories applicable. And what is more important is, once your bag is full, say around 3/4 of it is full, you will tie it up so that you wait for the authority to come and pick it up. In that case, you store it in a very safe zone, which is well ventilated, and there is no secondary handling or spillage by animals. And what is more important is that every staff in the dental clinic should have a thorough awareness about biomedical waste segregation. So I just show you how this waste is segregated. So these are your color-coded bins. So you have red, yellow, blue, and for sharps, you have a you have a puncture-proof container into which sharps are disposed. And we break the needles in a needle destroyer, and then the hub is carried on to the sharps container. And then your gloves go into the red bin. A few of these masks go into the yellow bin, and extracted tooth goes into the yellow bin, because human and animal tissues go into the yellow bin, and so on. The list is extensive, but it can be stuck across in every place of your dental clinic so that it is followed with utmost care. Over next to the dental intraoral radiographic mission. Before talking about intraoral radiographic mission, It is up to you to decide whether you're going to have your intraoral radiographic mission, or if you want to have an extraoral radiographic mission also, then you have to choose a separate zone for radiography. So if you're going to have only an intraoral radiography, you can accommodate it in your operatory itself. But always remember, you need to follow the principles of ALARA and position distance rule. ALARA, as we already know, it is as low as reasonably achievable. It is determined by the time of exposure, distance to radiation, and shielding. Next is your lead apron and thyroid collar. It is essential that both the operator and the patient have a lead apron and the thyroid collar. Ideally, we say a thickness of about 0.5 mm for wraparound lead apron and thyroid collars. And what is more important is that it should fit properly at the neckline and the armhole. Next, your X-ray machine should have an automatic timer and a cutoff control, and ensure that all the exposure parameters, your collimators, filtration, and the minimum focal spot to skin distance are followed as per AERB regulations. So now with the arrival of these AERB regulations, any X-ray machine that you're going to purchase, you ensure that the machine follows completely the AERB regulation, and they issue a certificate to you that the machine is already regularized by AERB. And next, I'm restricting myself to only intraoral radiography because there could be lack of time, and this entire dental clinic setup to put it across in 1 hour's time would be a little difficult. So here and there, what is required, we have just put it. So, but the rule of thumb is that any radiography should strictly adhere to the regulations of AERB. So this is an an intraoral radiographic machine in our facility with an RBG and the monitor and an ideal lead apron with the thyroid collar. So once you've chosen only an intraoral radiography, you normally decide whether it is digital or conventional radiography. So conventional radiography would use films, and the thing is, the films should be processed manually, or you have to go for an automatic processor. One difficulty is as it could. Then you get to use sensors, and then the image is generally obtained on the monitor immediately. So you have software applications for it, and generally pre-treatment, post-treatment images can be compared easily with digital radiographs. With this, I would like to end my talk and look at the rest of the. Thank you.
Thank you so much, ma'am.
Good evening, everyone. Let's proceed.
Yes, sir.
So, we're talking about the most important part is going to be the operatory and inner part of the dental clinic. So, I'm just going to highlight 2 points. The basic includes the dental chair with the light and the delivery unit working. Actual basic principles involves the operatory. So, operatory should improve the treatment efficiency by reducing the movements in and around the chair, allowing more procedures to be performed. The more the dentist in and around the chair is reduced, it increases the efficiency of the dentist. Next, it should facilitate the ergonomic positioning and methodology for both, as well as the dentist and the assistant who's going to assist him, which should finally deliver a relaxed practice method. So the operatory space should be flexible enough, easily it should be flexible enough such a way he can change anything in the future. So dental operatory. Usually the dental operatory is planned in such a way that it should be either an open place where multiple operatories can be involved, or a single entry operatory, or a dual entry operatory. When I say on open space, there may be multiple chairs which may be present. So this multiple chair is such a way that they are not separated by partitions, probably a small partition or a half partition. This is more common in a large setup where the multiple chairs are involved. Our small setups, we can use a single entry operatory. The single entry operatory is exclusive for one single room with a dental chair and the cabinets and everything. Or if there are two operatories, you can have a dual entry. Suppose in between the operatories, you can have an entrance so that you can operate between one operatory to another operatory. That is what we mean by a dual operatory. So dental operatory room layout and size. This is the most important part as far as dental operatory is concerned. Usually the position of the dentist in the clock position is what we think about as the primary aspect. That is, the dentist should be able to move around the patient chair in a clockwise position. That is, usually the dentist sits between the 9 and 12 o'clock position. Probably when he goes to the 12 o'clock position, he's behind the patient. Okay? And the movement is restricted between 9 to 12 o'clock if he's a right-handed dentist. Similarly, it's going to be 1 to 3 or 12 to 3 o'clock position if he's going to be a left-handed dentist. Similarly, the assistant's position is going to change if he's a right-handed. The assistant position is going to be between 12 to 3 o'clock position. Needs to practice minimal requirement 9 feet and a 10 feet. Next 10 feet depth. The position of the chair is going to be in and the width is going to be minimum of 9 feet. This is the minimal requirement for a dental operatory. Although it can be larger than this. Or sometimes, if the space constraint is there, it can be smaller, but the regular operating position of the dentist will be minimized if the operatory is less than this 90 square feet as such. And the door entrance, the operatory should be minimum of about 32 inches. That is about 2 feet and 3 inches, or probably 2 feet and 2 inches. That's how we say. This is mainly for the disabled patients with wheelchairs to enter inside to access the dental operatory. And adequate clearance should be given. As you see in the picture, right side and the left side of the chair, minimum 2.5 feet distance should be given so that the dentist can move around, or the assistant can move around the cabinets to approach any materials which is required in the know till now and what we do not know. Dental chair, yes, we are aware what kind of a how a dental chair looks, or what kind of a dental chair we are going to purchase. A compressor, of course, it is the most required part in a dental clinic. A suction, another important component of dental clinic. Earlier days, in the ancient days, there were no suctions. The patients were made to spit. Nowadays, the suctions has been developed such a way that the more complex treatments are made easy by use of suction. The suction itself is of two types. This is an intraoral suction, and due to the COVID era, now they have introduced something called as extraoral suction. Coming on to the dental chairs. What is the minimum requirement for a dental chair? The minimum requirement a dental chair is that neutral position should be maintained with no more than 20-degree angle to the head in order to view the oral cavity. That will be the minimum requirement for a dental chair, which can, if we can achieve this, it is a good dental chair rather. So leaving about the brands, we can look about only these points which will satisfy a dental chair. The dental chair brands can be chosen according to your needs, probably satisfying these norms. Second, the back width and the shape of the chair should allow the operator to position as and when it is needed to the patient, and it should have a stable headrest. Yes. This is just an image from the internet source showing a dental chair with a headrest on the right side. This picture depicts ideal requirements for a dental chair. It shows an adjustable headrest. The objective is that the patient can be examined and treated while lying in a comfortable horizontal position, so that both the assistant and the dentist, they can look into the patient's mouth while they are sitting in good work postures. This is the ideal requirement or the objective of a dental chair. Okay. So when I say comfort of the patient, so sorry. Yes. When I say comfort of the patient, the comfort of the patient is one major criteria for choosing a dental chair. Usually, the leg support is what makes the comfort more. It is more made comfortable. The leg support should be inclined downwards, which makes the seating easier, and the presence of armrest that adds to the comfort of the patient. That is, there can be an armrest or there can be no armrest. If at all it is present, the right side one for a right-handed dentist mostly should be an molded one in such a way that it can be moved away, or there can be no armrest for the right side, which will make the patient more comfortable. Back of the patient chair always should be thin enough to allow access to the dentist and the assistant's legs. In Western countries, when they use both the assistant as well as the dentist, they sit opposite to each other. That is 9 o'clock and 3 o'clock position. Almost the the legs being parallel to each other. That's how they work as a forehand dentist. So this dental chair should be so thin enough on the back of the chair, so that they can allow both the dentist as well as the assistant's leg. Next is the horizontal position of the patient chair. This is very important for visual and manual access to the patient's mouth. The horizontal position is in such a way that when the backrest, when placed horizontally, should be at least 80 centimeters above the foot. This minimum of 80 centimeters should be in such a way that from the ground, when it is measured for the backrest, it should be at a level so that the vertical 90-degree angulation of the knee can be rested. The patient chair to be moved upwards into a position in such a way that the dentist is able to work with a distance for precision vision. This precision vision is about 32 centimeters. Next, the base of the chair. Patient chair is small enough, should be small enough actually, so that adequate space for the foot controller is provided in that area. This is mainly the adequate space for the foot controller is in such a way that the foot controller will be placed on the left side of the midline, and it will allow the dentist to work in a different clock positions. The foot controller need not be changed in positions. The chair with the floor base, it moves in the direction of the patient feet. When the chair is raised, usually what happens is this diagrammatic representation is what represents the movement of the chair on the horizontal, and the base of the chair is lifted. So what happens is this is a parallel arm system. As and when the chair is lifted, the direction in which the chair moves will be in such a way that it moves towards the patient's feet. Why I'm saying this is, when you plan for an operatory space, you should keep in mind that at the floor level, the dental chair can be there. The measurement should be done in such a way that there will be about 2 feet distance at the back of the chair. At the same time, when the chair is raised, the chair is going to move towards the right, probably towards the patient's feet. So that amount of space also should be left in the operatory as a dead space, so that you will not have the patient's leg hitting the wall if at all it is closely placed. Next, most important part is going to be the light. This light is going to have the reflective prisms to achieve very good lighting, and there's going to be the attachment can be, of course, nowadays the conventional dental chairs come with the attachment. Sometimes if you plan it like a different kind of a dental chair, or you are customizing your dental chair, you can even plan it like a surgical operative theater, where you see the lights being fixed to the ceiling. The light can be halogen technology or LED technology. Nowadays they prefer LED technology, and it can be either a switch type or a sensor operated type. Next is the delivery unit. When I say dental delivery unit, the conventional chairs, they use the delivery unit. That is, it is being attached to the chair on the left side with the spoon, and over the patient it comes to the right hand side for a right hand dentist with all the 3-way syringes and the handpiece holders, sometimes even the scalers, everything placed there. So this is the over the patient delivery units. This can be customized in such a way that you can attach monitors to these side or rear delivery units and completely take away all the the holders onto the movable part, that portable ones. This portable delivery unit can be kept on the sides or on the rear, where, depending upon your own needs. We'll go on to this dental delivery unit. When I say dental delivery unit, what is it going to carry? It is going to carry 1, hand pieces and other attachments, 2, air or water syringe, 3, assistance instrumentation, which is the second arm, which might include the high vacuum evacuation ejector, saliva ejector, air or water syringe also. The dentist stool. This is the stool in which we are going to be seated. So it should be in a balanced sitting position. So you should select your dentist stool such that it maintains the lumbar curvature and back in a balanced position. And it should be a height adjustable one, and it should have a free moving wheels. So we were talking about dental delivery unit. We were talking about the dentist stool. We'll come on to something called as dental cabinets. When you say cabinets, you can have a ready-made cabinet which can be made, or you can customize your cabinet according to your needs. It can be on the rear or it can be on the sides, based upon the operatory size room and the operatory position. The customized cabinets according to your needs provides enough space for small to large instruments. That is, your regular cabinets, you can't take a measurement of each and every operatory space and go buy a ready-made cabinets. So it is ideal that you customize your cabinets in your dental operatory. So the cabinets can also house a comfortable working slab and a wash area. On the left picture, which you can see, the cabinets has got a beautiful tabletop with a wash basin, and you have cabinets in the middle also, and some storage cases in the top. A second one is another model where you just have a slab and the base unit. So going on to dental section. This is one area which I would say it's got vast differences. Based on the dental section, when I say usually what we use is usually attached to the dental chair. The vacuum, the function it performs is based on the nature. It is categorized into dry section, semi-dry, or wet section. Most of the manufacturers now provide the wet section. That is, the section will have a collecting unit, and there will be a water flush which will be added to it when it drains the outer waste pipe. And based on the airflow rate, whether it will be a high volume or a medium volume, the dental section can also be classified. And based on attachment, it is either attached to the chair or it can be portable. The advantage of being portable is that it can be moved from one operatory to another. Initially, the dental sections were bottle sections. When I say bottle sections, double bottle section where all the blood and saliva or all our liquids are collected and then it was manually discarded. Now it is all auto drain. When I say auto drain, it drains. Once the bottle gets filled up, there's an automatic cutoff. This cutoff goes off, which drains along with the liquid saliva. So next important part is what we call it as the compressor for the dental chair. This compressor usually should be a medical grade compressor, which should have an automatic cutoff. It can have a safety release valve and a drain valve also. A minimum of 35 liters is required with a noise free. And usually the compressor is connected by a half-inch copper lines. And air pipes to run under the surface of the floor to operatories. The size depends upon the number of operatories. Minimum they say is a 1 HP compressor. Nowadays it comes with 0.75 HP compressor for pressure parts. That should be enough for a single operator. The requirement is that there should be enough ventilation if it is interior. If it is outside, you should protect it from rain on a raised platform. And options are, there is something called as oil-free compressor and something called as lubricated compressor. You can choose any. Nowadays, the oil-free compressor is the one which is being used earlier. Earlier was one which was lubricated. Now there is a lot of oil-free compressors which are coming. So one more thing when we think of a compressor is that the contaminants can enter the compressed air system from the three sources. That is one, it can enter from the compressor, it can enter from the atmosphere, and sometimes it can enter through the pipework distribution system also. The pipeworks needs to be done. It can be done under the surface of the floor, or it can be usually in our own place, or when you have an option of doing, usually a concealed pipework is what is advised for both the water line, the dental unit lines. I'll come on to it later. Just to keep a brief on it, the compressor line, if at all it is going to run under the surface of the floor, it also carries some amount of air which may be contaminated. So for compressor protection, air inlet filtration can be fitted immediately upstream of the compressor, so that the air which is coming through the handpiece and through the handpiece to the patient's mouth for running the turbine will be a purified air. This is one part which we can take up. And any compressor, any type of compressor suitable for continuous running on load and start duty may also be used. This is just a picture which I picked up from one of the supplies in United States of India, where they go for plumbing specifications with pressure safety valves and other things. For a water pipeline, what is the type of water pipeline they use, air, what they use, and the waste, and even the vacuum, what is the size and the diameter and kind of material which they use. We can plan the operatory in such a way that all these lines are under the surface of the floor, and initial planning is very, very important as far as this lines are concerned. So once done, you cannot just take it back. So ideally, you plan it in such a way that you do all this beneath the floor. One more is the electrical power supplies. There are certain things which we can keep in mind. As many number of sockets, as many number of power points which you can use. Try to give the core of the electrical lines in such a way that it can withhold so many number of electrical supplies. The reason being, the number of gadgets which we use is always more than what the other kind of medical people use. So the gadgets, everything functions through the electrical lines. So number of power supplies, it can be minimum, but you try to maximize it in such a way that the number of lines or sockets can be increased. Yes. So coming on to dental unit lines, say the dental unit lines usually are of 4 types. One I would say is water line, another one is the air line, third is the waste line, and fourth is the electrical line. Of these, what I would rather put it is that the water inlet for chairs and basins, that would be the first primary one. Second, this filtered water inlet to the chair, if required, it can be RO treated. Third is the wastewater outlet from chairs and basins, and finally the air inlet to chairs from the compressor. So, sorry, slight jump. So, for a dental water line, adopt appropriate infection control procedures. It is use of filtration and sterile water delivery, purging of the dental unit water lines at the start and end of the day. This will give way for the residual water to come out. Whatever there's been, if there is been a backflow of water, this purging will take away the backflow of water. So this will reduce the contamination or cross-contamination between the patients. And discharge water and air lines for 20 to 30 seconds after each patient. That is, sometimes we recommend even the change of booster bottle every 2 weeks. That is complete change of booster bottle, not the water alone in the booster bottle, but even the complete change of booster bottle is advised. So this is a small picture to show the concealed lines which has been put. One is the right side gray one is the waste line. Second one is the electrical line. Third is the air, and fourth is the water inlet. On the right side of the picture, you could see a valve which has been placed for air and water inlet, and a waste pipeline with a small stump being put on top, so that there is no backflow of the smell which can come into the dental operator. So, COVID-19, what did we learn? Basically, all the setups which we are talking about, the dental operatory and everything, so far has been for the general setup. Correct. This, I think we will get all the information whenever possible. COVID-19, what did we learn? Basically, ventilation is one most important aspect. That is the air exchange, which needs to be taking place inside the dental operatory, so that you, as well as your assistant and as well as your patient, remains safe. And we should mind the aerosols. When we are using aerosols, we are supposed to be very careful so that there is no infection being transmitted from one person to the another. Hence, it is important we have to understand the concept of air exchange. So, when I say air disinfection or clearing, how do we do it? One is that we have to provide adequate ventilation such that the airflow clears the contaminated aerosols from the dental operatory, which can be reasonably achieved within a minimum of 6 air changes per hour. When I say 6 air changes, every 10 minutes, there's one set of new air which is made. This is mainly achieved by the HEPA filters, that is the high efficiency particulate air purifiers. There are a lot of high efficiency particulate air purifiers available in the market. For example, Sharp is been producing HEPA filters. The HEPA grade, anything over and above 11 or 12 is accepted as a medical grade. So there is something to do with Amway. There is some brand called as Atmosphere Mini, which uses this HEPA 13 plus filter. So anything over and above 11 is accepted. Second is the UVGI. When I say UVGI, ultraviolet germicidal radiation. This was usually previously used in operatories. The third one is the negative ion generator. This can be the negative ions introduced actually nullifies the aerosols Next is the fogging or the fumigation, which is going to take place. And the last one is the use of extraoral suction. So this is a picture which shows the air purifier. We are talking about air quality. In this, this will have 6 air changes minimum per hour. Okay? And the right side picture is one which is depicting the UVGI. This is a portable lamp. This has got about 8 watts. That is minimum of 40 watts being present in this UVGI, which can be shifted from one place to another. Probably 2-3 areas can be kept minimum of 15 to 20 minutes for sterilizing the operatory. Probably it can be left even over a period of time, probably overnight also. So air quality, what do we talk about in air quality is that one is air changes per hour. And second is positive airflow. Direction of the airflow is also important. Third, if at all we are not trying to buy air purifier, what else we do? We try to put up a pedestal fan and an exhaust fan in a particular direction so that the air quality also improves. Last one is the natural ventilation. So when I say airflow, air is drawn into the room from outside. This is what happens initially. And when I say positive airflow, the operator, the direction of the airflow is going to be from the operator to the patient. So, and then it is going to be directed, exhausted from the contaminated zone, that is from the patient to the external. Or if at all it is recirculated, it must be filtered through an high efficiency particulate air purifier. So next, we'll go on to the basic equipments which we use in the dental laboratory, and pieces and burrs, scalers, light views. Probably nowadays, intraoral camera has become slightly mandatory. I would not say mandatory. It's more impressive that other equipments which we were talking about, you would have learned in your own curriculum, but these can be made a little bit sophisticated by use of this intraoral camera. That is, you can very well show a patient if it is caries or whatever. You can explain the patient about their own conditions. It's like looking into a mirror. Other one is the endodontic instruments like XMart, where we use this rotary instruments and apex locators, where in certain patients where we cannot use X-rays, we can use apex locators, and needle destroyer, which will be mandatory for the biomedical waste disposal. Diagnostic kits, rubber dams. When I say rubber dams, now in COVID era, rubber dams have become slightly more important, I would say. It actually creates a barrier between the patient's mouth and our operation. So this is what basically separates us, or probably prevents more direct communication between us and the patient's mouth. And the restorative materials and the impression materials and extra-on-chain instruments, all these will be the basic materials and instruments which will be provided in the operator. Apart from this, where we miss out, or sometimes I would say this is mandatory to be had in our dental clinic, the emergency drugs. So one is oxygen. Almost any medical emergency, this oxygen is going to be of some help. There are some portable oxygens, portable cylinders which are available with a mask which can be used. Or there's something called as Oxy 99, which is a puff type of oxygen, like similar to a inhaler. This also can be bought and kept. Probably the use of it, you can try to read the user manual and try to find out how it can be used in case of emergencies. When I say emergency, that is the time when we have to act fast, and all this happens once, or probably it may not happen also, but if it happens, we are supposed to handle it in a proper way. So in that case, we should always keep replenishing this emergency drugs. Probably when we start the clinic, we just buy the emergency drugs and just leave it off. All these drugs need to be completely monitored on a time-to-time basis, probably replace it every 6 months as a batch. When you do it as a batch, you never forget. So you know this is the deadline for the emergency drugs to be changed. So the list of drugs, probably we have lots. We have textbooks to guide us to have what are the list of emergency drugs we should have in our dental clinic. Some of it I have listed: epinephrine, nitroglycerin, antihistamines, salbutamol or aspirins can be had as a first-line emergency drugs. Although additional emergency drugs like glucagon, atropine, ephedrine, hydrocortisone, and sometimes midazolam or lorazepam in case of epilepsy, we can use. This can be as a second set of drugs, which we will keep it as an additional emergency drugs. The last area which needs to be slightly monitored is the laboratory area. So it involves a working slab. It will have a sink. Sometimes cabinets can be added to it. You will have rubber bowls, spatulas, vibrators. You can have model trimmers, lathe, burner. Sometimes even dustbins can be kept underneath in a closed cabinet. So the lab area is mainly for carrying the impression materials, working on the if at all we are not working on a patient, we are working on models, this lab area can be utilized. So, in a COVID era, this donning and doffing zone is what is actually important. So whatever I was talking before is in the pre-COVID era. In the COVID era, this donning and doffing, you will have to identify the area or a space in such a way that you plan for donning as well as a doffing zone. Probably the center part could be the operatory. One side of the operatory, you can make it as a donning area. Okay. Once you don, you go into the operatory, work it out. Do all the procedures and then exit through the doffing zone. So posters can be displaying the procedures, how it can be done, the hand sanitizers, and probably the third one is the PPE. The number of times we use hand sanitizers, of course, we do use a lot of times. But when we are wearing a PPE, the PPE involves personal protective equipments. That is a face mask, preferably an N95 when we are dealing with an aerosol procedure. A face shield is a must. Probably we miss out on face shield. Sometimes we wear the mask, we think we never get into the virus. I would say the face shield is the first protective equipment which will prevent the virus, the outer aspect itself. Second protection is going to be your face masks. Okay, if you are not wearing a face shield, suppose for a consultation itself, you can wear an eye protector, probably glasses, disposable gowns or fabric gowns, that is full cover gowns when you are doing an aerosol procedure. But over that, you will have a coverall. This coverall can be an additional. Okay, disposable gloves. Usually the latex and the nitrile gloves can be used. Usually a double glove is what we do it in our procedure. That is nitrile glove as a first layer, and the second one can be in examination gloves or surgical gloves according to the need of the procedure. And disposable hair and foot covers be used and changed accordingly. So in addition to this, what we use is the fire extinguisher. What we should have is the fire extinguisher. In our state, this Clinical Establishment Act actually makes this fire extinguisher mandatory. So we have purchased a fire extinguisher, and this should be placed about 6 feet from the floor of the place where commonly which can be easily accessed. Okay. Apart from this, you need to have a stabilizer. When I say stabilizer, individually for each and every equipment, you can have a stabilizer or calculate the overall load and have a complete centralized stabilizer. That will be ideal if at all you are planning for a bigger area. Of course, in addition to it, when you are adding the number of chairs, the calculations can be done according to the load which it is going to take or the number of operatories you are going to add on. The third one is the power backup. The power backup is important if affordable. When I say, I don't say affordable, for a start of a practice, you can use an inverter. The inverter usually comes with a battery and a UPS. This will support for about 4 lights and 4 fans, which can run for 4 hours, depending upon the VA. So this can be your initial start. As and when you're adding up your operatories, or when you're slightly widening your practice, you can shift to generators as a power backup. The difference is that the generators, when it is put, even your compressor can run. So the capacity can be brought in such a way that the compressor can also run. So the take-home message. Promise yourself that you will provide the utmost care and ethical services to your patients. This will itself expand your patients' number. That is by word of mouth. Best way to make your presence felt in the locality is by the patient's word of mouth. Update yourself constantly. Constant updation actually is knowledge. Knowledge is power. Great Italian painter, sculptor, inscribed the phrase "ancora impara," which means I'm still learning. He did this at this age of about 87 years on a sketch he was working there. So when in clinic, all our thoughts and focus should be only there, as we need to understand that we are dealing with human lives, and hence individual attention every moment in clinic by dentist and other staff should be given to the patients. Lastly, plan your finances wisely. Actually, gather all the financial statements, preferably your lab outcomes, and everything should be made in probably all this should be calculated. All the list of expenses should be calculated. Only then you should see your profit. And whatever you want to invest from the profit, you might add more. So I would like to thank Dr. A. Praveen Devaprasad. A special thanks to him, Chennai Smiles, for sharing his pictures and most of his views in establishing the clinic. He's a special friend of mine. And Dr. R. Aravindan, Arvind's Dental Clinic, who gave insights on the biomedical waste, and the team, the Tooth World.
Thank you so much.
So I would like to thank the principal, Dr. Neetu ma'am, head of the department, oral medicine and radiology, Dr. Satyaranjan Mishra, for giving me this wonderful platform to share our clinical experiences. I would like to thank even the my UG and PG teachers, and thank you all for the patient listening. And I would like to extend my thanks to my parents, our parents, I would say, and my daughter Harshita, who also had helped us in this presentation. Probably the internet part of it, or whatever, the online platform, she was well versed than us, I would say. Probably aging. They are faster in learning things than what we do. So I would like to thank Harshita also in this platform. Thank you all for patient listening.
Thank you so much. Thank you, Dr. Mishra. Thank you, management of SOA, for giving us this wonderful opportunity. Thank you, the entire team, oral medicine at IDS. Thank you so much.
Thank you so much, Madam and Sir, for this enriching lecture on this particular topic. With the elaborate discussion and explanation, I'm sure everybody present here is overwhelmed. With your due permission, Ma'am and Sir, should we go forward with the questionnaire session?
Yes, sure.
Sure.
Okay, ma'am. So the first question is by Dr. M. Shweta. So she asks, how to provide adequate ventilation in a clinic? The practicality of a ventilation. how to adequate ventilation?
One thing is, if you have more windows in the clinic, probably keep the windows open. And from the dentist chair, back of the patient's head, you can keep a proper portable fan which can run in such a way that it is going to give you a positive airflow. So whatever the patient is going to breathe or patient is going to give away is going to go outside by the positive airflow. So that is one part of ventilation. One. Second is you can use a HEPA filtered air purifier that gives you an adequate air exchange. That is one more thing which can be used now in more sophisticated way, I would say. If that is not possible, use an exhaust fan on the outside and use a portable fan at the back of the dentist chair.
Thank you, sir. The next question being, is laser better as there is no use of water in this COVID era?
Pardon, I didn't get you, sorry.
The use of laser. Ask you to elaborate about the use of lasers as there is no water in this COVID era.
No water.
There's no use of water in the COVID era. Yes, of course, lasers can be used depending upon the need for treatment. When and where is what is important. Wherever the lasers could be used, of course, it will add an advantage over using the water in this COVID era. Do I accept that? Yes.
So Dr. Mrityunjay asked, should we work without an air conditioner in this COVID era? Like.
Okay. So air conditioner, if at all it is used, it should be used with a filter. Nowadays, the air conditioners also comes with a filter. Ideally speaking, if at all you are using an air conditioner, you use a filter in the air conditioner itself, along with HEPA, the air purifier. You can use an air conditioner. It is not that you cannot use an air conditioner.
Sir, another question is it compulsory to get all your patients tested for rapid antigen test for COVID, then to proceed for a treatment these days?
Okay, this is quite a tricky question, I would say. If the patient can afford, you can definitely test them for COVID. Probably when you are doing a aerosol procedure or a long-standing procedures, you would say the viral load is going to be more. Where you feel the viral load is going to be more, and your exposure to the patient or the time which you are going to give and repetitions, how many repetitions you are going to call for the procedure. All this will depend whether you need to do a testing. Of course, the rapid kits are now.
So there is another question regarding the compressor sound. So if the compressor is placed in the clinic, which is the sound is unavoidable. So what to do about it?
Yes. Okay. Preferably try to have a tubing and push the compressor outside. If at all it is going to be placed inside, place as far as possible from the dental chair. The tubing can run in such a way that it can go slightly longer also, probably on the sides of the walls, and place it as far as possible from the dental chair so that you can minimize the loss. Of course, if it is placed inside the operatory, the sound is unavoidable. That's how it is.
Thank you so much, sir. So this was the last question. So I would now forward the session to the head of the department to conclude the session. Over to you, sir.
Well, it's a formal vote of thanks now. At the outset, as always, we thank the Almighty for making things happen. And this is the only webinar lecture, as I said, we have it in the evening. In spite of your power failure, rains, you are able to finish it well. That proves that the Lord is happy with us and the knowledge is being shared. And I would extend my thanks to our management, that is Professor Manoj Ranjan Naik, who is the president of the Shiksha Anusandhan Dimchibi University, our Vice Chancellor, Dr. Ashok Kumar Mahapatra, both of them have always encouraged in our academic sessions. And of course, Dr. Neeta Mohanty ma'am, our dynamic dean, who actually envisioned these webinar series, mostly because of our interns unable to learn many things. And of course, they'll soon be getting their degree, but they do not know what to do, how to set up a practice. So this was an enriching experience for everybody to learn. And of course, both of you, as my good friends, you agreed to give your time in spite of everything to speak on something which is a bit tricky, because everybody is speaking about COVID. So what to tell, what not to tell can be questioned. So agreeing to speak on this, guiding with each and every detailed thing was really good. And already we get very good feedback about the lecture. So at the end, I'll be sharing with you most of it. And so it's a very big thanks to both of you for sharing your knowledge and expertise with us. And at the end, I would like to acknowledge my team, Dr. Sanat, Dr. Rajat, Dr. Abhishek, Dr. Smita, Dr. Basant, and of course our excellent PG team. Already Dr. Rupsa with her painting is famous now. We have Dr. Subranita, Dr. Namrata, Dr. Sushmita, Dr. Anamika, and Dr. Purvasha helping us out. And each of them is doing something. Somebody is live on YouTube, somebody is doing it live on Facebook. So all this is possible because of them. And last and not the least, our dear participants who have heard us in spite of everything. Thank you all.
Thank you so much.
Thank you. Thank you so much. Thank you.